Raising young children in a new country, supporting early learning and healthy development. Refugee and immigrant families come to the United States with a wealth of parenting strengths, drawing on culture, tradition, and family experience. Like most parents in the U.S., they tend to be responsible and nurturing, and have often sacrificed tremendously to provide their children with an opportunity for safety and success in this new country. At the same time, newcomer parents have experienced incredible loss, including the loss of extended family members, community, and homeland, and they must adapt to new traditions and lifestyles that are often at odds with their own beliefs and practices. Refugee and immigrant families also must overcome cultural, language, and practical barriers to access the community services they need, while these services must also learn about the newcomer families in their communities and how best to serve them. There are extraordinary benefits for refugee families when community agencies and Head Start programs work together. Benefits include access to center-based early childhood development services, which enable refugee parents to go to work more quickly after arrival in the U.S., comprehensive assessments and services for the whole family in the areas of education, nutrition, health, and mental health, and family engagement opportunities, which support families to be involved in their children's learning as well as help them to pursue their educational and financial goals. Virtually all refugee parents with children up to 5 years of age will meet the income-based eligibility requirements for Head Start services when they first arrive in the U.S. Since Head Start programs emphasize responsiveness to the growing culturally and linguistically diverse communities in this country, the benefits of a partnership between Early Head Start and Head Start and refugee resettlement agencies are clear. This module was created for Early Head Start and Head Start programs, refugee resettlement, and other community agencies serving refugees and immigrants in order to ensure that newcomer parents have the basic information they need concerning raising children birth through age 5 in this country. Although newcomers may find the module useful by itself, it is primarily intended for community service provider staff to use together with their refugee and immigrant clients. The module is targeted to newcomer parents with low levels of English proficiency and/or low literacy levels. Since the often complex concepts illustrated here are necessarily simplified, the resource section provides easy-to-access information for service providers to supplement the basic points in this handbook. In addition, users will find complimentary tip sheets that are part of the collaboration toolkit produced by BRICS and the Office of Head Start National Center on Cultural and Linguistic Responsiveness. For best results, we recommend using this module in culturally and linguistically appropriate parent activities or events, preferably run by staff in collaboration with an experienced newcomer parent and U.S.-born parent of the same ethnicity. Such activities can provide refugee and immigrant parents with opportunities to ask questions, try out new behaviors, and find positive support to help ease their transition to a new country. See BRICS' other online learning course, Parenting in a New Country, a toolkit for working with newcomer parents, for more information on parent support groups, including curricula and other resources. This module emphasizes the following 6 themes. 1. Family well-being. Parents are responsible for their child's well-being. This includes a variety of activities devoted to health maintenance, such as healthy lifestyles, diet management, hygiene, and oral health. 2. Safety and protection. Parents are responsible for supervising their own children in the U.S., both inside and outside the home, and for keeping them safe from harm before birth and throughout childhood. 3. Guidance and discipline. Discipline methods vary by culture. Common early childhood methods in the U.S. include positive reinforcement, redirecting behavior, directing choices, and establishing age-appropriate rules and consequences. It is important to know what is acceptable in the U.S. and what is not so that newcomer families can adapt methods that work for their families. Discipline is most effective when applied consistently and when desired behavior is modeled by parents. 4. Healthy brain development. A critical period for brain development occurs from birth to age 5. Parents play an important role in providing young children with nurturing and stimulating experiences, such as positive interactions, talking, playing simple games, reading, playing outdoors, and using routine activities as learning opportunities. These early experiences profoundly influence how children's brains will develop and how they will interact with the world throughout their lives. 5. Early learning and school readiness. Learning begins at birth. and the first 5 years are vitally important to children's future success in school. Parents are children's first and most important teachers and can help children develop a lifelong love of learning by spending unhurried time talking and playing, by exploring and discovering together. Using everyday routines such as bed, bath, meal times, and trips to the grocery store can be used as opportunities for learning and communicating family language, values, and beliefs. 6. Connecting to early care and education. An emphasis on parent involvement with child care and early education providers may be new for some refugee and immigrant parents. Education is viewed as primarily the teacher's responsibility in many countries. In the U.S., child care and early childhood education settings often encourage parents to be actively involved in their child's development and education, as well as within the program. This includes attending meetings, parent-teacher conferences, volunteering at the center, and engaging in home learning and other activities.